You're on mute, sir. Judge, we can't hear you.
Thank you. Can you hear me now?
Yes, sir.
Very good. All right. Thank you very much. Welcome to this virtual video press conference. I don't know that we've done it entirely this way before. We've done some press conferences before where we had a few folks in the courtroom, but this will be our first 100% virtual, so hopefully this will go smoothly, technology permitting. Welcome to all of you. I'll try to keep this fairly brief today. I know our healthcare professionals are extremely busy right now, and I very much want to say thank you, first of all, to those that have provided some time this morning to give us a quick update and overview of what their situation is and their status, operational status is at their respective institutions. Hopefully this information will be beneficial to the public. Really the purpose of the briefing today is simply to provide that our area healthcare providers an opportunity to share information about their current status, operational and otherwise, what they're seeing, and hopefully the situational awareness from their perspective will also help the public. I also hope that this briefing today will serve to re-emphasize the three overriding health protocol guidelines that our health authorities have been telling us for several months now, which are social distancing wherever you can, face coverings wherever you can, and especially when you can't social distance, and washing your hands. And if we get that message out and continue to get that message out, I think it will help our healthcare providers. So hopefully those two objectives will be reached today. As of yesterday, Texas reported more than 11,300 people hospitalized with COVID. According to the state website, that leaves 745 staffed ICU beds available in the entire state of Texas as of yesterday. So again, I thought it would be good today, and I want to say thanks again to our healthcare providers for being available today to give us an overview of what they see at our local area hospitals as the entire state is being stressed at the moment with COVID patients in our hospital system. So at this point, what I'd like to do is call on Dr. Chadwell, our Bell County Public Health District Director, let her make a few remarks, and then I'll recognize several of our healthcare providers that have logged on. Dr. Chadwell, welcome.
Hey, can everyone hear me okay? Just double checking my audio.
Yes.
Okay, perfect. And pardon me for looking at my notes. I want to make sure I don't miss anything that I wanted to go over with you all. So I'm just going to do what I normally do, which is just cover where we sit as far as epidemiological stats are concerned, and I have a couple of other points to make, but I'll make this as brief as I can. So the first thing is that we're seeing the same kind of trend that we saw immediately following Thanksgiving, which is a small drop in our incidence that's probably artificial based on fewer people going to the doctor during holiday. So we are expecting to see another spike. If I had to guess, I would probably put that occurring at about the end of this week, perhaps early next week, depending on when people begin to seek care. I hope that we had more people complying with our recommendations for social distancing and masking and not gathering than we did after Thanksgiving. I would really prefer not to see another spike, especially given that our foundation now it's too high. Our incidence rate over 500 is significantly high. To put that into perspective, the CDC considers a rate over 200 to be a red zone. So a 500 per 100,000 plus incident rate it's not good. We have a lot of work to drive that down. Now, one of the things I do want to point out, we're getting a lot of calls from people complaining about businesses, complaining about people that are not in compliance, and absolutely give us a call and let us know. But I do want to emphasize that we don't have a lot of authority to enforce. We have very minimal authority. I can't say we have none, but it's very, very limited. But we will do everything we can to educate people and get them to comply as much as we can. But I can't promise that it will be perfect. But certainly we're going to try. The other overriding question I've been getting lately is about the vaccine, about when we expect to start delivering the vaccine and what that's going to look like initially. We know that some health departments in the state have received a vaccine. Some started receiving them last week. We have not yet received vaccine here, but we are expecting perhaps this week, maybe next week, we should be getting some. I can't tell you exactly when. That will depend on a number of factors, but we will certainly be entering into the tier 2 of phase 1A when that happens. And if you need the link to the whole vaccine plan from DSHS, I can provide that after this, and you can go into all of the nitty-gritty details. But tier 2 is, and I'm going to read from my list so I don't forget, so pardon me for that. It's going to be our physicians, nurses, and support staff, such as custodial staff in hospitals. They're likely to be seen in the healthcare setting. They probably won't be coming to us, but they certainly can. We're looking also at our laboratory staff, rehabilitation staff, and other clinical diagnostic staff, non-911 transports, healthcare workers in detention facilities. We're also looking at community pharmacy staff. They'll probably take care of themselves in-house, since I know some of the clinical pharmacies have been receiving vaccine. They are also supposed to be taking care of nursing homes, and I do believe they have started to do that, but I don't know the timelines on that yet. The additional components of tier 2 include JPs, anyone dealing with decedents, embalmers, and medical examiners, as well as school nurses. So that group will be our focus, and of course, public health staff. So that group will be our focus to start with, but we haven't given permission by DSHS to flex between tiers, because their focus is certainly use the plan, but don't hold vaccine and don't run the risk of wasting vaccines. So that has been Commissioner Hellerstadt's really serious point on vaccinating. So as we feel that we've cleared most of the second tier, we can flex to the next tier and start focusing on our at-risk population over 65, people with health conditions, that kind of thing. But when we'll get to that next phase will depend on a number of factors. I can't give any really solid timelines yet, but I'll keep everyone informed as I know. And I think that's all I have for you. So whoever's next.
All right, thank you, Dr. Chadwell. At this time, what I'd like to do is just kind of go around the screen looking at our healthcare providers that are here and recognize them, give them an opportunity to make a few remarks. And then after that, I'll open it up and let any of our media folks that are on the line ask any questions of anyone that has spoken, and we'll do that for just a little bit before I close it out. At this time, I'd like to recognize, and if you would, as I recognize the healthcare provider, if you'd introduce yourself, just who you are, what your position is with the institution, and then make whatever remarks you like. So I'd like to start with Baylor Scott and White. Shaheen?
Good morning, Judge. Can you hear me?
Yes, I can.
Excellent. Thank you. I'm Shaheen Motorcap. I'm president for Baylor Scott and White Medical Center here in Temple. And I'm going to beat the same drum that you heard from Judge and Dr. Chadwell. Let me start with a message of hope and a sincere appeal. So as we approach the new year, and with the vaccine now arriving in our state, there's much hope on the horizon. In the meanwhile, we ask for continued vigilance. The safety and well-being of our community starts with each member and the decisions we each make. So I ask the public to continue to show that sense of urgency, follow the recommended guidelines Judge talked about, Blackburn talked about, the physical distancing, masking, and hand hygiene. We each have a role in our community to prevent hospitalizations and intensive care admissions while we're protecting ourselves, our loved ones, and our communities. We are seeing substantial increase in our med-surg and ICU patients. As Dr. Chadwell talked about it, the trajectory is concerning. We're projecting very similar projections as she had. In a couple of weeks, we're expecting what I'm going to call the Christmas peak. Unfortunately, if we don't show some discretion around social distancing for New Year's holiday, we're going to see another surge of that surge. That puts the hospitals in a real bad situation in terms of capacity. We could do a few things. We could delay non-urgent surgeries, but these non-urgent surgeries are not elective per se, and they can be put off indefinitely. We've already begun rescheduling some of these non-emergent procedures that require overnight stay. But again, we need your help to show a little bit of discipline in the weeks to come. COVID, as you know, is a health risk to our community, and we need everyone to participate. Our healthcare professionals are true heroes. They're working around the clock to take care of our community. For the past 10 months, they've been carrying this burden that will continue to fight for us, but we really need to pitch in and do our part. So I'll close the way I opened, to just beg the community to show a little bit of refrain from social gatherings this New Year's holiday, and help protect the community. Thank you, Judge.
All right, thank you, Shaheen. And I don't think you indicated your position there at Scott and White, but I believe, and I'm going to get titles wrong, I know if I do it, but President, CEO, Baylor Scott and White, Temple.
Yes, sir, I'm sorry. I'm the president for Baylor Scott and White Temple Region, or Baylor Scott and White Medical Center here in Temple. Very good. Thank you. I know the press will want to know that. All right, thank you, Shaheen. Appreciate the comments. At this time, I'll go to Advent. Kevin, are you on the line?
Yes, sir. Good morning. Can you hear me okay?
Yes, sir.
Thank you. Judge, we appreciate the opportunity to speak with our community and our media. And I think Shaheen said it very, very well. The vaccine is our latest and greatest hope, but we are testing that hope by the current wave that's coming in of COVID positive patients. Here in Colleen and in Lampasas, we're a two-system hospital system network here. We have our highest COVID utilization ever. This is significantly more than either of the previous peaks. And so this is putting stress on our critical care beds in particular. The medical surgical area is also strained. We are able to manage things, but we have surge plans in evolution right now. So fortunately, we're better equipped in terms of testing than we were in previous waves, and we have a solid PPE. So we are prepared, but our staff are getting fatigued with all of the overwhelm that's coming. So we are also hopeful, but we want to emphasize those same things that Shaheen mentioned: masking, social distancing, hand washing. Those things are critical to us getting to where the vaccine really can make a difference. So we appreciate your vigilance around that. We are here for you. Our hospitals are going to always be there to serve our community, but it's a team effort right now, and we need your help too. So that's all I have to say. I don't know if I mentioned, my name is Kevin Roberts. I'm the CEO of Advent Health Central Texas. So I just remembered that. So
very good. Thank you, Kevin. We appreciate your remarks, and thank you for your work and your service, as well as Shaheen and all of the Baylor Scott and White healthcare workers too. At this time, I'd like to recognize Patrick Swindle from Seton Medical Center, Harker Heights. Welcome, Patrick.
Yeah, cool. Can you hear me fine as well?
Yes, sir.
Cool, perfect. So kind of, and I don't want to sound like a broken record. Obviously, Kevin and Shaheen did a great job kind of talking about a lot of the things that we're dealing with, as well as what the other facilities are. Same concept. We're getting pretty full in regards to, from a facility perspective. We are not at where our max was previously, and I guess in that second surge we had in December. From a volume perspective, we kind of at where our all-time high in COVID volume. Now, as we sit, we're kind of lower. We're still running above our normal run rate. We were running kind of throughout the year, so we're not kind of at our highest point at the moment. But as folks have kind of said, I think we can assume that we'll probably see something probably in the next few weeks. Well, ultimately, I want to stress what Shaheen and Kevin did, as well as Dr. Chadwell and others, is for us, it's incredibly important that folks follow the social distancing rules and the guidelines. I know our staff are doing that now. We don't let our staff go more in break rooms. I think we have at max 2 people in a break room at one time. We are implementing these same exact things on our own staff and our own folks here that we're asking folks in the community to do as well. So what I can say is we're taking it seriously from a vaccine perspective. I know it kind of the latest piece is we were kind of the last ones to get the vaccine here in the community. We've already gotten over 1/3 of our staff vaccinated with the Moderna vaccine. So that's gone very, very well. We've actually had, from what I can see thus far in the elections from our staff to take the vaccine, approximately 75% of our staff have elected to take the vaccine. So that's really exciting stuff for us to know that our staff are taking it seriously as well. They want the protection and the hope that comes with the vaccine. So ultimately, PPE-wise, we're doing very, very well. We have approximately 3+ months on hand in all the main categories for PPE. So we're prepared in regards to PPE for another surge. However, staff-wise, like Shaheen and Kevin both said, our staff are stressed. It has been a long, it's kind of, I'll use the phrase like this. I was talking to someone previously, I was asking, how have they ever dealt with this previously before? And it's almost like a hurricane that comes in to these coastal hospitals and just stays there the whole time and doesn't leave. And it's that same concept we're dealing with now, is just trying to manage through that continual crisis, and our staff have done an amazing job. And I'll say this too, Shaheen and Kevin and the rest of the folks here, the communication amongst all the hospitals has been tremendous. And I think it will continue to stay that way. So, we're just hopeful that we can continue to get through this and see the vaccine impact that it has. So that's about all I have. And once again, my name is Patrick Swindle. I am the CEO for Seton Medical Center, Harker Heights.
Thank you, Patrick. Appreciate your remarks also. I'd also like to recognize at this time Colonel Lucas from Darnell Army Medical Center. Colonel, welcome.
Good morning. Thank you. Can you hear me?
Yes, sir.
Okay, great. So again, my name is Colonel Jim Lucas. I was previously the Chief Medical Officer here at Cervantes prior to deploying, and since my return, I'm now serving as the Deputy Commander for Strategy and Outreach. Similar story that you've already heard from all three of our network partners. We're seeing numbers rise. We're seeing our testing numbers rise. And we're reaching our limits as far as our abilities in the critical care arena, and really we have the potential to expand. However, staffing is the issue, as I think it is with all three of our partners over there. Is that our staff, they're tired. Some of them are sick as well and out on quarantine or isolation, and it makes a continuous challenge making sure that we're able to staff all the beds we need to take care of COVID patients. But other than that, we're doing well from that perspective at Fort Hood. Elective surgeries, we are still conducting elective surgeries, but looking very critically at limiting any elective surgery that would need a bed post-operatively. And we also are vaccinating. We've successfully vaccinated a fairly significant percentage of our hospital staff, and the DoD has authorized us to begin administering some vaccines to phase 2 beneficiaries, some of our high-risk beneficiaries, as we have had a vaccine available. But again, to repeat everything that's been said before, continue masking, hand washing, social distancing, those are the keys to minimizing what I think will be another expected spike. But hopefully we can keep that spike as manageable as possible. So that's all I've got. Thanks so much for the opportunity to join in.
Colonel, thank you very much for your work you're doing on Fort Hood and for all the healthcare workers there also. I have one other note from one other area hospital in Coryell County, but could not be on the call, but I'll just briefly summarize the note that I received from David Byram, who is with Coryell Healthcare Systems. And the note, in essence, said that they've also seen what all of our healthcare providers here in Bell County have seen, which is continued growth in positive tests, unusually high volumes over the past few days, and they're expecting more, and that their system also managing but stressed at the moment. One other area that I'd like to touch on is the jail, our Bell County Jail, just for informational purposes. As of this morning, we had 1,010 total inmates in the jail. 963 of those were incarcerated in Bell County. We do have some that are incarcerated out of county at the moment, but total 1,010. Of that total, 23 are currently in quarantine. for COVID observations, but we do have 3 confirmed COVID, lab-confirmed COVID cases in the jail at this time. At this point, again, I want to say thanks to all of the participants, but I'll open it up to our press if they have any questions. There's a feature on LifeSize, if you're familiar with it, much like any other video platforms, raise hand feature. It should be on the bottom portion of your screen. And if you'll click on that, raise hand, I'll recognize that as I see those hands raised. And then hopefully we'll keep from talking over each other. All right, I see a raised hand from Andrew Moore. Mr. Moore, good morning.
Good morning, sir. So I have a couple quick questions, I guess, for several of you. First of all, for the healthcare district, I didn't know if you were getting the Pfizer vaccine, the Moderna vaccine, or both, and I didn't know if there was some sort of specific timing for when phase 1B would kick off, or if the state tells you when we move from one phase to the next phase. That was going to be kind of my first couple questions.
All right.
Okay, so for me, sorry, want me to go first?
Yes, I'm sorry. I was going to direct it to Dr. Chadwell first.
Yes, okay. So as far as your question, there are no solid timelines right now, and we do not yet know if we're going to get Moderna or Pfizer. Now, as far as I know, health departments that have received up to this point have received Moderna, so that would be my guess, but I can't say for absolute certain until we get it. And the way it's been working for other health departments is they're kind of getting the notice, hey, you're getting doses tomorrow. So we don't get a lot of advance warning, so we're just kind of sticking by the phone waiting to get the call to let us know when it's coming. And as far as when you can move to the next phase, that's really up to those doing the vaccinating. So when you feel that you've cleared the tier you're working with, the DSHS commissioner sent out a letter saying, look, don't hold the vaccine just because you don't think you're finished with tier 1. If you have people ready in tier 2, move to tier 2. You can flex between them. It's really up to those giving the vaccine to make the decision as to whether or not they're ready to move to the next phase.
Can you move from phase 1A to 1B if you have enough?
As I understand it, yes. As I understand it, yes, we can.
Okay. And the second question, I didn't know if any of the local hospitals here, I didn't know if you've had to contact FEMA or going to contact FEMA for some help, if you have any surge plans. I know that happened with Ascension, Providence, and I guess the Waco area. I didn't know what the surge plans looked at this time, and if anybody is looking at trying to expand their ICU or trying to get more nurses. So I didn't know if our doctors could talk to that.
This is Kevin from Advent Health, Central Texas. I can answer that on our behalf. So FEMA, no, we're not. We wouldn't know how to pull that lever probably, but we are working through our RAC, which is our Regional Advisory Council around emergency management. So that is a daily, conversation that everybody is very, very well connected into. So the RAC has various resources. For instance, with staff that might be out for COVID or for quarantine or whatever, we do ask the state, and they've been very, very supportive, actually, to offer staffing, nurses, nurse aides, various technicians, and so forth, that can support the healthcare at the local level in the hospital. So we have, our hair's not on fire, but their support has really helped, and we continue to reach out for that on occasion. But that's not a FEMA action; it's local. It's a local action through our RAC, which is a little more deliberate, kind of a motor that's running all the time during this whole crisis.
Okay, and then I guess the last question I had was I guess this would be for actually Colonel Jim Lucas. If you could get your, we could see you on video here, but we had a call come in saying that somebody heard that there was a vaccine going out from Darnell that might be first come, first serve. I didn't know how you guys were operating there, if you were able to start serving maybe some people in that phase 1B, that would be like the 65 or older. So I didn't know if you guys were able to process that faster. So we were wondering what the process was for distributing the vaccine, if there's any first come, first serve component for the community out there.
Yeah, right. Thanks for the question. Sorry, I don't have video capability, so you just get the blue screen for me. But yeah, so I can't give a whole lot of specifics, unfortunately, because of DoD regulations. But we have transitioned and are beginning to offer the vaccine to some of our higher risk beneficiaries. It is sort of a first come first serve basis. But as we continue to get more vaccine, hopefully we will continue to be able to offer that to our beneficiaries, obviously with the goal of getting as many vaccinated as possible.
And that's just for people who live on Fort Hood, or who would those beneficiaries be?
TRICARE beneficiaries. So those who are, either dependents of active duty who are high risk, or dependents of retirees or retirees themselves who are TRICARE beneficiaries.
Okay, sounds good. And I guess lastly, and this is probably kind of in line with a lot of the calls that the county has got, but I remember that, myself and my wife driving home a couple days ago, and we went by, I won't say which bar it was, but we went by a local bar. It was packed, cars throughout the whole parking lot, and we're thinking, is there, can they have that many people right now? Is there anything that the health department can do about this? I mean, for that, all these people kind of looking in the situation and seeing all these people out right before New Year's Eve, what can we say about, what can be done about this, what the message is about that?
Yeah, Andrew, let me take that question if I can. And I'll sort of let Dr. Chadwell jump in if she'd like to. But as you may recall, under the governor's orders, there is an opportunity for counties to opt in or opt out to allow bars to reopen with certain restrictions, with certain capacity restrictions also. Bell County, I signed the authorization to allow bars to reopen. I don't remember the date of that, but it was several weeks ago, maybe a couple of months ago, whenever the governor authorized that to be done. The enforcement process for that, in terms of whether or not those bars are complying with the restrictions under the governor's order, is enforced by the Texas Alcoholic Beverage Commission. And so what I would encourage folks to do is, if you see what you believe are potential violations or restriction or violations occurring at any of the bars, face coverings not being there, capacity restrictions exceeding, whatever it is, if you think there's a concern there, I would encourage you to contact TABC, Texas Alcoholic Beverage Commission. If you go to their website, there is both an email and I believe a phone number that you can call and make a direct complaint or request for an investigation. On top of that, what I will be doing over this next few weeks is monitoring that situation also from the county perspective. I'll be reaching out to our local TABC inspector, an investigator, and if we see issues, concerns, such as you have identified, and we can verify those, then there is the potential that I could revoke that opt-in order and the bars would be closed again. So we're going to be monitoring that, and I'm going to work with TABC over the coming days to see if that's an issue or a concern, but I do rely on them to advise me under any enforcement issues that they're having.
Okay, sounds good.
And I'll go ahead and jump in and just add a little bit to that, because this has been something that's come up a lot and a lot of people asking us questions. And, again, we don't have enforcement authority at the health district. We can't issue citations. We can't shut anything down. We do not have that authority. What we can do is contact the business and do our best to educate them, let them know what they can do better, and try and get them to comply using the carrot rather than the stick. But what we can do as well is, when it comes to retail restaurants, we have a little bit more authority, obviously, because we have state authority imbued in us to exercise that authority over them. But when it comes to retail, shopping establishments, Walmarts, what have you, again, we can talk to them. Bars, we can talk to them. Nursing homes, etc. We don't regulate them, but we know who does, and we can reach out to that regulatory agency and let them know if we feel that there's a problem and they're not going to comply.
And so just to reemphasize that point, I mean, as Dr. Chadwell indicated, I think they do provide what she called the carrot in terms of trying to educate. The stick associated with that would come from TABC. and from revoking the order that allows those bars to be open. So we're going to do a two-pronged approach over the next few days and weeks, again, to make sure. And while we're on the topic of bars, just in general, in terms of indoor gatherings, and I'll look around the screen here and see if any of the healthcare professionals will disagree with this, but my suggestion or my encouragement would be for all of our community, all of our residents, all of our businesses to, as I think Shaheen mentioned in his comments, probably be really cognizant of any indoor gatherings that might be planned over the next week or two, whether they're at work or whether they're social functions. Maintaining the social distancing, the face coverings, washing the hands, all important, but we might need to reconsider some of the indoor gatherings that typically occur this time of the year. And if we do that, that might help mitigate some of the spread that we have been seeing.
Is there any concern about the number of the percentage of the trauma service area of, I guess, the percentage capacity of the hospitals? It seems like it's getting pretty close to 15%. Is there a concern it's going to go over that?
I'll let the healthcare professionals address that in terms of whether or not they have concerns about that and how they're managing it.
Yeah, this is Shaheen. I'll go first. Yeah, there's concern around that. We have actually one of the lower numbers in the state, which is concerning because we tend to be a little bit behind other regions in our state. So as we start advancing up the same trajectory as Dr. Chappell talked about, it puts more pressure on our healthcare system. Patrick talked about it, I think it was Patrick, that we work very closely and we work very well together as hospital systems in this region. But ultimately it becomes a numbers game. Judge Blackburn talked about this thing. We need to show some discipline in the next 2 weeks to just make sure we change the trajectory of what we're seeing right now. Yeah, there's concern.
Anyone else want to chime in or just nod your head that you agree with that? Yeah, I see everybody nodding heads. All right.
I'll little point, if you don't mind, just to make the point that you all noticed that we moved our threat level in advance of that 15% that you highlighted. And the reason we did that is just to echo what Shaheen just said. It's not about reacting to the virus. We want to be engaging in prevention, and that requires that everyone pay attention to the measures that we're telling them to utilize: the social distancing, masking, avoiding gatherings, because we don't want this to be, well, we're at 15%, now we're going to do something. We want to try and engage in prevention and take steps before we ever get there. We don't want to get there, but there is concern that we're getting too close.
All right, thank you. There's been a hand up for some time, so Andrew, I'm going to move off of you for the moment. I'll come back to you if you still have another question. Ms. Shipley, I think you had your hand up. Go ahead.
Yes, thank you. Sierra Shipley here with KXXV. So this is kind of leads into what we were just talking about. With your guys' hospitalization rate, it's jumped back between that 12 and 14%. We haven't reached 15%. So how are we hoping the vaccine helps the hospitalization rate? And what's predicted as you guys push out this vaccine to people?
Well, I can take that one. Truthfully, the vaccine will not have, it'll be a drop in the bucket for the next month if we're lucky. Really, we're talking about the frontline providers. I mean, Lord willing, those vaccines are going to keep our healthcare providers safe so they can take care of the patients that are coming in. But in terms of the spread in the community and the penetration in the community of the vaccine, it's not going to make any difference in the near future, which is why the emphasis on sustaining vigilance is so critical, because it's almost like, you're swimming and having trouble swim and you can see the shore. Well, you still have the distance between here and the shore before you're safe, and we just can't let the waves crest over us. So the vaccine is the shoreline. We know that, but it's further than we would like. So we just have to do what we know is best now.
Yeah, this is Shaheen. Bloomberg is now tracking the vaccination rate by state, I have it on my other screen. We're at 0.51% vaccination rate right now based on what's being reported. I think most people that are in Dr. Chatfield's field, at least I think I'm repeating it correctly, that we need to be around 70% to reach that herd immunity. So we have a long ways to go. We have a lot of hope, but we have a long ways to go to get to those levels.
And just to add to that, yeah, the generally accepted threshold is 60% on the low end would be acceptable. 70% is a good moderate range, 85 would be better. So it's going to be a long time before we get there. We haven't seen, to my knowledge, and correct me if I'm wrong, but I don't think any of our frontline providers have even received the second dose yet. And it's 7 to 14 days from dose 2 for full immunity. And we don't even know yet exactly how long that lasts and how often you might have to get revaccinated if that's something that this vaccine requires. So we're at the very start of this vaccination program, and it's going to be a while before we see a significant impact.
All right, thank you, Dr. Chadwell.
I had one more question, if that's okay. As far as, McLennan County, they've reached past 15%. They've been over 15% for over a month, or just about a month. I think tomorrow would be a month, for some time. They've been at 23%, almost 10% higher than Bell County. So does that worry you guys as far as a county so close with such high hospitalizations? What does that say for as far as the due diligence that Bell County puts into their efforts for keeping the hospitalization rates low?
Well, excuse me, let me turn my screen on, but I'll address that in a very general sense. But what I would say is I want to say thanks to our healthcare providers that we have in Bell County, the ones that you see on the screen here and the organizations that they lead and the workers that they have. I think the message that we have been trying to get out about, again, that three-pronged attack to try to mitigate the spread, social distancing, wear your face coverings, and wash your hands. We've just got to keep pounding that drum. And as Kevin just mentioned a minute ago, I like the term sustained vigilance. I mean, we just have to sustain that approach. But I think we just got to continue to do that. But I'll let the healthcare providers make any specific comments if they think there's anything in particular that is attributable to our incidence rate being a little bit lower and our management of that being a little bit lower. But I would say thanks to them for the work that they're doing, and to our residents for heeding to the degree that they have the call for, again, the guidelines.
Yeah, this is Shaheen. I don't have any insight as to why we're lower than adjacent counties, but I will tell you all of our hospitals receive patients from surrounding regions, so the risk for us isn't just associated to Bell County. As we see flare up in counties adjacent to us, we have to take care of those patients as they come to us. So we are at risk, and there's benefit to us for all the counties around us, including Bell County, to show some restraint.
All right. I see a hand up from Matt. Matt?
Hi, Matt Stem with KWTX. This question is looking down the road with vaccinating some of our high-risk groups in the later phases. Can you talk about how some of those orders will be, like the order of priority have been determined, and some of those talks that are going on right now?
I think that's probably for Dr. Chadwell.
Yes, yeah. Dr. Chadwell.
I can speak to that a little bit. So the Department of State Health Services convened a panel. There are some local health department personnel on that panel, state personnel. I can't remember everyone that is on the panel, but they're the ones that kind of came up with this vaccine plan and determined who gets it first and what those phases look like, et cetera, so forth. So exactly what their rationale was for those decisions, I can only hypothesize because I'm not on the panel. But that's who came up with that. And again, I'll send out the link to the whole plan so you can read it if you haven't read it already after we're done here. As far as, I'm sorry, repeat the second part of your question. I'm trying to remember exactly what you were asking.
Yeah, just in terms of some, like determining some groups, like, obese individuals versus other individuals, determining that priority and that order.
And again, I can't really speak too much to why they made the decision to put them in the order that they did, other than if you look at mortality, if you look at who has been most adversely impacted by COVID, that was probably the driver for them as far as what drove those decisions. Obviously, first responders are going to be continuously exposed, so there's the obvious reason why frontline healthcare workers and all of them were included first, because they're exposed constantly and continuously all day long. And then, of course, those at highest risk are at highest risk for mortality. So certainly we want to do our best to protect them. And when you're looking at incidence rates as high as what we have, people ask me all the time, how do I avoid getting exposed? Other than the measures that we tell them to take, such as masking, avoiding gatherings, washing their hands, it's really hard to avoid it if you go out in public at all, because we have so many people who do have COVID in the population. That's why we ask the public, please follow these measures, please do everything that you can, because I have a lot of people that'll tell me, well, I'm 30 years old, I don't have any comorbidities, I don't have to worry about it. Right, maybe you won't get sick, but you may expose someone who will get very sick. And that's kind of the message we keep driving home. But as far as those priorities, that vaccine panel has been making those decisions. And I think that they've made good calls with the priority. And like I said, DSHS commissioner did give us the ability to flex between them and kind of decide when we're ready to move on to the next phase. Obviously, we're going to try and stick to the plan as much as we can, but we're not going to sit on vaccine. If people, say in tier 2, seem to be trickling in, we might move to the next phase to start on the next group.
And Matt, I would add to that, just again, as a non-healthcare professional, but remember the basis for these protocols in general, just the underlying overall basis, which is to preserve hospital capacity. I mean, the idea behind these protocols is not to eliminate the risk. It has never been that. As Dr. Chadwell just indicated, very, very difficult, if not impossible, to do that. These measures are intended to mitigate the risk. And so as this panel prioritizes the cohorts that will be available for vaccination, I think the underlying basis for that is to preserve hospital capacity to address that. So you need healthcare workers. You know, if you're going to have people sick and they're going to need hospitalization, and healthcare workers are a high priority. So that's the first cohort. Those individuals that have underlying medical conditions that are likely to be hospitalized would be, again, a high priority to cohort. So in my mind, again, as a non-healthcare professional, I just tend to always evolve back to, okay, what's our objective here? Our objective is to preserve hospital capacity. And if you apply that in coordination or in conjunction with administration of the vaccine, I think that helps you understand what the cohorts are and how they're prioritized.
Yeah, and just one follow-up question for Dr. Chadwell. I know you said that it's unclear when the vaccine will be coming into the health district. You said maybe sometime next week. What's being done to sort of reach out to these groups, to tell them when these vaccines might be available? Yeah.
And we've been in consistent communication. Our preparedness director and our immunizations coordinator have been communicating with the different groups and the different tiers, and I've also been communicating with our local governments and our board just to kind of keep everyone in the loop. And again, no hard timelines, but I'm letting them know information as I receive it so that they know and they're ready, and they are aware that we're going to be using an appointment-based structure because it will be easier to administer to people if we don't have lines out the door. We can only handle so many at a time. And so we're communicating with them and just giving them information as we receive it. And I sent out some emails this morning. We're making sure that we're prioritizing communication with groups in the appropriate tiers, and we're letting them know who to reach out to, when to reach out. And of course, there have been some that have said, hey, if I can I go to CVS to get the vaccine? And we put them in touch with CVS to answer those questions, that kind of thing. So it's just a matter of just regular coordination and communication, and we've been doing that.
All right, thank you. I see Ms. Shipley's hand, so I'll recognize her, and then maybe one other question, and then we'll wrap up. So Ms. Shipley?
Yeah, sorry, just wanted to clear something up on my end. As far as vaccines going out, I know as far as the general public, obviously there hasn't been any, but have healthcare workers have received the vaccine, at least the first part of it. Is that correct? And can we, and I apologize again if this was already said, but do we know how many people have been vaccinated, no matter their title, in the county?
I'll have to defer to Dr. Chadwell, one of our healthcare providers, in terms of the number that have been vaccinated. That was part of the question. I don't recall the other part. Dr. Chadwell?
So I don't have any data on that in front of me. We haven't received vaccines, so the health district hasn't done any vaccinating yet, but our healthcare providers were going to have to answer that question as far as they're concerned.
Yeah, so I'll answer the first part. As soon as we received our vaccine, I think it's probably true for all of us hospital administrators, we started vaccinating our staff within the tiers, as said by our own organizations or by the state. So we started almost immediately as soon as we got them.
Yeah, and this is Patrick Swindle. Kind of same thing as Shaheen said. We as well, when we got our vaccine, I think the day we received it, we started vaccinating people. And we have our own internal tiers kind of set forth, as Shaheen said, trying to do our most at-risk folks first, ER, your ER physicians, your ICU nurses, your ICU staff, those types of folks, as everyone has said, to preserve our capacity to continue to care for patients when and if there is another surge or whatever it may be. So, yeah, we've done the same. We have approximately over 200 of our 546 employees have been vaccinated, but we've had approximately 75% say they would like to be vaccinated. So we have enough vaccines to hit all of our people. It's just trying to make sure that we time it appropriately and schedule it appropriately. We have our night shift, some of those PRN folks, as well as, once you open a vial, you have to use it. So we have to make sure we have 10 people. So for Moderna, it's 10 doses in one vial. And so we have to make sure we have 10 people ready to get that vaccine. We've had some people kind of come off here and there. Oh, I'd like to get it. And we have to get them all within 10. If not, you can waste vaccine. And by golly, we're not going to waste anything. So there's a lot of that coordination that has to come into effect as well.
All right. Thank you. I see one more hand. We'll make this the last question from Andrew.
Yes, sir. Thank you. Just to kind of pin this down as much as we can. So when phase 1B kicks in, or there is vaccine available for phase 1B, how will the public specifically be notified that that would be available? So if you got, let's say we got a 66-year-old guy named Murray, really wants to get the vaccine, what does he need to pay attention to? Where can he line up for this kind of thing?
Well, I can speak on behalf of the health district. We'll use our standard channels, which is social media, and obviously letting our media partners, you all know that people can reach out to us for appointments, and that's when we're ready for the general public, and we'll let them know, okay, if you fit criteria X, you can let us know if you want to receive the vaccine and call us to make an appointment. And that's going to be the way that we let people know. So if they don't follow us,
it'll be an appointment. There won't be like, people won't get like a line somewhere, because I can see that.
Right. Because as was alluded to a moment ago, it has to be coordinated. This vaccine requires that, 10 doses for Moderna, as was stated. We want to make sure that we make a certain number of appointments per day based on what our clinic can handle, so that we're not opening a vial and using part of it and potentially running the risk of any waste. We want to avoid that, so it's about coordinating and make sure we're making appointments. And our plan for the moment is to stagger, so that we do appointments in Killeen, we'll do some appointments in Belton, and we'll do some appointments in Temple on different days to try and make it as easy as possible for people to get to us. So when we're ready to start doing that, we'll be putting out schedules and letting people know when they can reach out.
Thanks a lot.
All right. Thank you, Dr. Chadwell. I think at this point, I'll go ahead and wrap it up. We've been almost an hour, so I want to say a couple of things in closing here. One is, again, thank you to our healthcare professionals for the work that you're doing, first and foremost. Thank you for being available today to answer some of the questions that we've had and to provide just an update and overview of what you're seeing around the community. I want to close again with really encouraging folks, urging folks to practice social distancing. wherever they can, wear their face coverings, and wash their hands frequently. Those three things have been the hallmarks of our healthcare authorities' advice and counsel for months, and we need to continue that sustained vigilance that Kevin mentioned a moment ago, and that is really the best thing, single thing, those three things that our residents can do in our community to help each other, and we want to see that continue. One other comment, and again, it was mentioned also, and I've been getting some inquiries in my office and through the county about, again, indoor gatherings and whether or not those should occur and how they should occur. And again, my counsel and my advice, based on the advice of these healthcare professionals, is that we would discourage those indoor gatherings that have historically occurred this time of the year. There are certainly ways that, they could be allowed or permitted, but again, we would discourage that, I think, and I think our healthcare professionals would echo that. Again, it just serves to mitigate the effects. All right, at this time, I would, again, say thanks to everybody. I'll close this conference, and again, thank you all for participating. Thank you.